So for this, instead of D&D, because no one was available, and because we are two people who, while we both enjoy D&D, we also are veterans of the medical field, so to speak. You deal with a more nursing-esque setting, and I deal with a more privatized nursing home setting. I just think that this is one of those things that it could be very funny for us and be very relatable. So that is why I dragged you in here to watch this today.
Fun.
Let's begin the torture, the reminiscent horror of things that we've seen.
Sir, because your heart rate is so high, we have to give you something called adenosine.
Okay.
Wait, is that gonna stop his heart? No.
Yes.
Actually, yes, but not forever. What do you...
Have you ever had to watch adenosine get administered?
I have not, but I know what it does.
Yeah, it's scary, isn't it? Thankfully, we don't. Yeah, we don't use it at the nursing home because most people, and this is kind of morbid, most people have DNRs at the nursing home.
Yeah.
So you really don't do stuff like this.
The last place I worked.
Yeah, this
was
is
the same way. Most of the people were not like.
Yeah, this is almost always being administered by like ER or like paramedic on site, but. Damn, isn't it scary, huh? Like when you read about it and you're learning about it, and you're just like, yeah, it stops your heart, and like 90%, of the time you come back, like 90% of the time. But that 10% is doing a lot of lifting. One of those things that I'm so glad
I've never actually had to give because there's no way.
It's scary.
It will be okay forever. Well, because his heart rate is so high, we have to chemically restart it so it'll start working normally again. But everything's gonna be okay. Okay.
It's the medical equivalent of turning it off and turning it back on again.
It really is restarting the router.
Oh, I feel.
There's the brief horror.
Oh my God, is he?
Weird. And there it is.
That's better. God, I hate adenosine. Holy crap.
Okay, so right off the bat, GSW, right? I have a nursing home. Never had to deal with the GSW. Did you do a rotation in ER before you are where you are now?
I did, but I never saw GSW.
You didn't see a GSW? Those shits are crazy because everyone's different. You know, what hit a bone, what bounced around, what splintered, who caught a ricochet.
Yeah.
That shit's scary.
Excuse, sir, you heard
I do know at some point
they shot
somebody was brought into our ER for stab wounds, but I wasn't like they had enough staffing. They didn't ask for any extra hands down there.
Yeah. Well, this looks like one of those situations. I mean, like he's in a car, right? Probably a drive-by, but I mean that's a couple bullets. You really hope that the door caught him, but as a gun guy, I'll tell you right now, those doors ain't bulletproof. Doors ain't bulletproof at all. Not on a standard convertible, like whatever car this is. Like that door didn't do anything. Like he took those shots.
No.
But I'll tell you something. Fucking adrenaline's a hell of a drug. I guarantee you don't feel them.
my car.
Yeah. Few times, but more importantly, did they hit you?
Yeah, I think I felt something hit my leg. A few? Wait, what? How many is a few?
Sir, do you think we can maybe focus on you for a second? I mean, bullets can hit things like your leg and bounce around in your body, causing more
Wait, bounce around? You think it bounced around inside of my door? Oh, my window's definitely broken. I'm gonna need new tints. I'm gonna need a whole new paint job. Hey man, how many times did he hit?
Your guess is as good as mine.
I have met people like this. I have met people like this who are like, especially in the nursing home, who are just like, sir, what? You're getting mad about the wrong thing. Like, priorities. Like, you are here for rehab so that you can, like, use your legs or whatever. Why are you getting mad about, like, oh, well, now if I'm not home, my lawn is going to die. Like, dude, priorities. Like, walk again should be above your bushes dying at your house. Like, you could always plant
literally
new bushes.
all the time.
Like, obviously, that's a little bit of a different from being actively shot and caring about your car, but priorities, man. Like, some people just don't, the priorities don't click, and it's just, my God.
It's you. Oh, dude, I'm so glad you're here. He's right there.
Hey,
I thought somebody called for an opioid overdose.
We're gonna take some guesses here. Gentleman sitting on the couch, full of ice on his crotch. What are we thinking? What's the diagnosis?
He definitely saw on the internet that shocking the system with ice was gonna help with the situation.
Yeah. Well, yeah, because you just said opioid overdose, right? So what are you thinking? You're thinking, dude, conked out because he probably took heroin or something, And then his buddy didn't have any Narcan, and he Googled it, and he's like, oh, shock the system. So he just started dumping ice on his privates, right?
Yep.
Now, I'm not a doctor. I'm fairly certain that's not a real thing. I don't think ice on the privates is a medical treatment for opioid overdose. I would suggest Narcan. I think that is the current king of opioid overdoses right now. You could buy it at CVS. If you got a roommate or someone who's using, just buy Narcan. Please don't use ice.
I feel like maybe in some circumstances it could help.
Yeah,
but
I wouldn't bet my life on it.
No, exactly. I wouldn't either.
Oh no, it's definitely him. But I managed to wake him up.
Oh, cool. So you gave him some Narcan?
No, I covered him in a bunch of ice.
Oh, okay. And that worked?
No, that didn't quite seem to work.
I don't like where this is going.
Okay, so what did you do? I put some in his rectum.
And we're getting okay. So we're gonna amend our previous statement. Don't shove anything up someone's ass when they're out on an opioid. Narcan goes in through the nose, so that doesn't need to go up an ass. Also, even if that did work and you brought him back, the frostbite and damage to the GI tract from shoving whole ass ice cubes into your rectum,
great.
that is going to cause so much more problem. It isn't worth it. Like, just Narcan. It's not expensive. Most places it's free. In some cities it's free. If you go to the police, they'll give you Narcan for free.
Literally all the Narcan I have I got for free.
Exactly. And it's not, and it's got a good, like, the expiration date. It's easy to apply. It's easy to use. Do not shove ice up your friend's butt if he opioids out. Just use Narcan.
Oh my god.
Please. If anything, even if he survives, you're never going to be able to look each other in the eye again. That'll tell you right now.
Nope. Nope.
Could be worse.
I guess.
Yeah. Hey, somebody called for an allergic reaction?
Hey man, I got stung by jellyfish earlier and it's still swollen. It hurts really bad.
Okay. Am I the only one who saw all the yellow in the tub?
I saw it, yep.
So jellyfish, yellow in the tub. We're
Piss.
thinking, yeah. They don't know, do they? They don't know that that's a wives' tale. Well, I guarantee you he's going to say it, but spoilers, peeing on jellyfish, that's not a real thing. That's
doesn't actually do anything.
It's just really fucking embarrassing.
I think I should probably get checked out.
Yeah, looks pretty swollen. There's actually a pretty simple way to ease the pain, though. Pee? We all already did that.
All?
All? Yeah, so I peed on the stain, but that didn't work. So Mike tried to pee on it, but he didn't have a good enough stream. So Jimmy tried to pee on it, but he couldn't get the right angle. So he peed into a cup, poured it on the sting, but that didn't work, and now we just don't know what to do.
Why wouldn't you stop after the first one didn't work?
Yeah.
Like, okay, I get it. You didn't know. Pee on him. Fine. And then it didn't work. And you're like, you know what we need? More pee.
More pee.
And not to change our strategy. More pee. And so then his buddy couldn't pee. So then he got his third buddy to pee into a cup. Oh, man, you know drinking was involved. You know they were 4 buddies at a beach. They were getting toasted. And then someone got stung, and they're like, guys, I got this great idea. We just got to piss on it.
All of us.
Dude,
all of us.
First one goes, it didn't work. You must not have pissed enough. We just need more piss.
Water! you just soak it in hot water. That's it.
Well, that would have been nice to know earlier.
You think?
I smell so bad. Fire rescue, somebody called for a sick...
That's one of those things, too. The actual way to treat... I mean, you're not coastal, and neither am I, but I've been on boats my whole life. The actual way to deal with jellyfish sting is just hot water between 107 and 113 degrees Fahrenheit. Like, mildly hot water. And that will remove the sting. It'll denature the active, like, damaging aspects of the venom of jellyfish. It's not rocket science. It's just hot water. Not piss. Definitely not 3 of your buddies' piss.
Person. Hello? I can see everything, man.
Uh-oh.
What are you on, buddy?
Batman.
That's,
I'm not sure what
he's
took.
not angry,
He's
though.
been like
It's
that
got to
for
be
2
like
hours.
edibles.
I'm Batman. Hey, buddy, did you take anything? I don't know, man. Did you take something?
That's edibles.
He should go to the hospital, right? Honestly, I'm not sure what they're gonna do for him, but it's gonna be a fun ride no matter what.
Fire rescue, somebody called for chest pain?
Hey, he said he's having a lot of chest pain.
Oh, sir, you don't look very good.
Yeah, I know.
The
Okay,
stress
so
of
what
car
happened?
maintenance,
You
that
were
can do it
working
to
on
you.
the car and then you started to have chest pain?
Oh no, it was actually after the car fell on him that he said his chest was really hurting him.
I'm sorry,
Oh,
what?
God.
Yeah, he was under.
Fell on him? What was he using, a Harbor Freight Jack? Like, that's a whole ass car. Is he alive?
He probably shattered his fucking
Fucking
ribs, bro.
Beat the car.
His
working
buddy's
on
so
it, and then
calm
the
about
jack
it.
Slipped out and he was a meat pancake for about half a second.
It
sir, can
slipped
you,
out.
I mean, clearly he probably didn't put it on the jack. He probably didn't put it on the correct jack point, right? He probably just eyeballed the jack points, or he's not familiar with the car, and he jacked it up, and it slipped. Either jack slipped or the stand slipped, or he wasn't using stands, and it was just straight jacking. But I'm more concerned about, like, how would he get out from under the car? Like, his buddy's like, he was for half a second. So does that mean the car is lifted enough that it just crushed him a bit and he got pulled out? In which case the damage might not be that bad.
Like, maybe it just, like,
Yeah.
bounced off his chest
Yeah,
with the
right?
suspension and then, like,
Yeah,
kind
like,
of
it just
cracked
tapped his
a
chest,
few
right?
and
Which
just
is still
crushed-
bad.
Yeah.
Still very bad, because that could puncture a lung or lungs. But my bigger concern is if the guy had to pull him out if the other friend had to pull him out because the car was putting active pressure, now you've got a crush injury where you took the crush off. So now you've got all that damaged cells backfeeding, and it's going to cause so much more damage for crush injuries. Like, depending on how long he was being crushed.
Mm-hmm.
Like, that's the kind of thing that you have to amputate limbs for when you get your arm pinned or crushed under a car, and it takes a couple minutes for it to get out. That can be bad. The potassium backflow could stop your heart.
Lift up your shirt, please.
All right, well.
Oh,
crap.
Oh, crap.
Oh crap.
Ouch.
that's
What do you want to do?
Drive really...
that's internal bleeding.
Really fast.
That's a hemorrhage. That's
Bam. 2 milligrams of Narcan
Yep.
on board. Dude, did you just slam that Narcan? Yeah, man, I've never had a problem when I slam.
flash zone.
Is he okay?
You've
Blech.
yeah. Have you administered Narcan?
I have not had the
The luxury.
privilege.
Did they tell you? Did they tell you when they showed you not to slam it? They told you to go slow, right?
Everywhere I've ever been has always said it just knows.
No, I mean, like, when you put it in the nose, like, do you do a slow shot, or do you hit the whole 2 milligrams? Like, when did they make you train on dummies?
No.
Oh, so basically, when you apply it, right, you can, like, not temper, but you could take a second or two to administer it, or you could just blast the whole thing for, like, to be the quickest way to get it in. But if you blast the whole thing, if you blast, like, 2 milligrams in, right, it'll cause, like, your sensory overload. And I think it's about to happen because he's making it into a short, but you'll see what happens.
They vomit.
Are
for
you
sure.
okay,
Oh,
bro?
yeah.
Okay. Are you sure you?
There it is. Immense nausea.
I guess he wasn't.
Yeah.
Jeez. Oh god.
And this is why when you work on a paramedic, you bring an extra set of clothes to work.
I'm really okay now. Wonderful.
Yeah, never slam it.
Hey, what's going on, bro? Busy day? You have no idea, man. We literally just cleared from the hospital and got hit with this one. But what's going on?
Oh, our patient Mike here blasted his thumb with his old trusty
there.
hammer, and his
Been
boss
there.
wants him to go down to the hospital and get it checked out.
All right, cool, man. Well, we'll get him loaded up and get him going down to the hospital.
What's missing? I just noticed it.
There's no stretcher.
There's no stretcher in this ambulance. Have you ever had like an EMT leave any equipment at your place?
Not that I know of.
I had a they didn't leave the stretcher. I had someone getting admitted, and they came through AMR, and they got dropped off, and they left the laptop because they had to
great.
because they had all their admission paperwork and all their paperwork and stuff, and they forgot the computer that they have all of their stuff in, and they just had it in the stack, and they thought it was the resident's computer, and they drove away, and they came back in like 5 minutes. They're going, "Did I leave a computer?" And I go, "Yep." And they took in, they're like, so sorry. I was like, no, I've been there, man. I was like, that was like our 5th admission of the day. I'd seen these people like 3 times. I was like, it's one of those days, man. Do not even worry about it. We're all in the same boat. We're all doing the same job. But it is super embarrassing.
Oh, crap.
Isn't there supposed to be a stretcher back there?
Yes.
Is it still at the hospital?
Yes.
Would you like me to ask the patient to sit on the bench seat so you can bring him down to the hospital and get your stretcher back?
For the love of God, yes.
Awesome. Oh, and you're never gonna
Never
live
gonna live
this
that
down.
down. Yep. They're gonna joke about that for
Head this
10
way.
years.
Fire rescue. Hey, I was taking a shower. I slipped and fell and...
Oh, you know, slip and fall in the shower happens a lot more than people want to admit. Especially, you know, nursing home, right? Resident. We have a lot of slip and falls. It happens. It's unfortunate, especially with the elderly. Obviously, we don't know the age
We
of the...
know at least one person that slipped and fell in the shower in her
Yeah.
toes
And
at
here's
our
the-
age.
it-
So.
it happens, right? It's a slick environment using soap, shampoo, all that stuff. I mean, that's
Yes.
especially the older you get, the more dangerous it gets. The number 1 cause of death over 40 is accidents. Slip and falls count. You know, it's very dangerous. So I don't like to joke about it. We don't know this person's age because obviously he is doing the acting for all the positions.
Yeah.
So I'm assuming it's like an elderly person, but it happens. You know, it's not necessarily embarrassing.
I'm not gonna lie to you. I don't think that's the situation we're looking at right now.
You know, I was thinking it could be the alternative situation, and I just don't want it to be, because the alternative situation is far more embarrassing and far more cringy. So I'm gonna hope.
I can guarantee you it is that because he said I fell and
Maybe he just fell and hurt his spine, and now he's
no.
nervous. Let's
This
listen.
man has something in his ass for certain. Let's go.
No, surely not. That never happens in the medical field, ever.
Okay,
Let's find out.
and you hurt your back? No, my back doesn't hurt. But you fell? Uh-huh. And you're in pain? You could say that. Okay, I'm a little confused here. There's a soap bottle in my rectum.
Yep,
Okay.
there it is.
Yeah, there it is. Okay, there it is. I was trying my best. I was like, let me give these nameless patients the benefit of the doubt. That happens so often. It's so annoying.
Yep.
Luckily with me, with the nursing home, it's not as big as the thing. Most people have grown out of it at that point. But
Never put anything in your butt that doesn't have a flared base.
that doesn't have a flared base. I would go so far as to say, when you're alone in a shower, don't put anything up there, because with enough force, anything will go up. So I say, don't even do it. Just finish your shower, and then whatever you do after that, do after that. Don't do it at the same time. Don't try to. What are you trying to save time? Were you gonna brush your teeth at the same time too? It's not worth it. It's not worth it. Just don't do it, because now you put the paramedic in an awkward situation, where he's trying not to judge you, but he's also doesn't know how he's gonna help you. You're gonna end up back at the hospital, and then they're gonna take it out, and then they're gonna put it in the box of things that they pulled out of people's asses that week, and it's a big box. What's the where you are? What's the weirdest thing one of your seniors has ever said that they've taken out of somebody?
See, nobody's really told me about the things that they've taken out, but I do remember that while I was there, it's actually interesting that the flared base doesn't always work.
Yeah.
And somebody had to have an actual like silicone sparkly butt plug surgically removed from their rectum.
Dude, I bet you the insurance company loves that.
Yep.
They're like, what are we getting charged for? Oh, you know, the butt plug incident. Oh, 3rd time this week, huh? Yep.
Third time this week.
Well, they did different one for every day of the week. This one happened to get stuck.
Oh yeah.
But
of course.
I know, having done this for as long as we've done it, I get terrified of shit like that. I was like, I don't, because my luck, the day will happen that there's something happens that is an accident, right? Like, you never know. Sometimes you accidentally fall. Sometimes you accidentally fall in the shower, right? I don't ever want to accidentally actually have that happen, because I know no one's gonna believe me at the hospital.
Nobody.
Because what's the thing? What's the thing that they always say? Oh, I fell on top of it. No, you didn't. No, you didn't. You put it there on purpose, and it got out of hand, quite literally. But no one ever believes. So now if you go and you say,
literally,
you quite literally put it in there by hand. But now the question is, like, you get there and you're like, okay, well, I could be honest and say I didn't like no one wants to be honest because it's embarrassing. So they lie and they all tell the same lie, and all that does is tip people off to know that it was intentional, and then it's just awkward. I mean, you're obviously we never change our level of care, right? So like we're never gonna treat you differently under any circumstance, even if that is the case or not. That's goes against how everything about medicine works. But even for me at a lower level and you at a higher level, we don't judge and then change our care plan based on how much we judge you. But once you're safe and discharged and you're good, I'm gonna make so much fun of you. Like I'm
It's immediately gonna be like, oh my god, what?
You're gonna turn into a story I tell the new guy. When the new guy says, oh, nothing ever happens. And then you're gonna be I'm not gonna use your name because HIPAA, but I'm gonna tell the whole story and I'm gonna say everything you said.
It's gonna be like, wait till you hear about the shit that happened 2 days before you got hired.
Yeah.
Like the whole thing. The whole thing.
And
you fell? Does it really matter at this point?
There you go. Does it matter?
No. Go ahead and get going.
Ambulance, please.
I'll kick you right in your ginger face. You come any closer, sir. I just need you to calm down so we can help you.
Combative
I'm
patient.
help you rearrange those freckles on your carrot top mug with my foot here in a second. Come on, man. We can't do anything for you unless you.
You ever had a patient take a swing at you?
Not one that knew what they were doing.
Yeah. Okay. Yeah. Well, this guy, I don't know what this guy's problem is. Maybe they'll say it. He might be like delusional. But I had not even 2 weeks ago. I had a patient that was leaving AMA, and they called an Uber, and they're like, "I'm leaving," and they didn't even sign the discharge papers. They were just trying to leave the facility, like go AWOL, and I'm like, "Yo, that ain't how this works, chief." Like he was cognizant. He was just a mean guy, and he had a bridge to burn with my discharge coordinator. He thought she was like scalping him for money, like she was making up papers and giving unnecessary reasons to stay to like bleed him dry. Like, he called her a bunch of names. This is this little girl. Like, she's older than me, but I say little girl. She's like 5'3". And he's like, he was trying to get into the Uber, and he has like a cane and a walker, but he was mobile. Like, he walked in without using the cane or walker. He just had him folded up, so he was mobile enough. He was like in his, he's middle-aged, or a little older than middle-aged. And he was like, there was a point where she went up to him with my head nurse, and I went with her because I had a bad feeling. And she's like, you can't leave, unless you sign these discharge papers, because then we can't discharge you with your medicines. Like, she had a bag of medicines that he was supposed to be taking. And he was screaming and hollering, and he was making gestures. Oh, he was pointing. He goes, I'll get you. I'll come back, and I'll get you. Watch your back. And I'm like, these are threats. Like, these are threats. I was like, I put myself in front of this girl, and he got out of the Uber. And he's like, oh, what are you going to do? You going to hit me? And I'm like, I'm not going to hit you first. I was like, but if you don't think I'll put you in that car, if you hit me first, I was like, then it's over. I was like, I can't lose the job. I'll put you in this car. I'll fold you up and put you in this car. You'll fit. But I'm just not going to hit you first. But I was like, if you're going to point and scream and threaten this woman, this like 90-pound soaking wet 5'3" girl, who all she's trying to do is discharge you, and you're going to start screaming and threatening how he was like 6 something. He was a big guy.
The craziest thing about these people is it's not like we're saying you can't leave. You want to leave?
Just sign the
go
paper.
for it. We just need you to sign some legal papers. Otherwise, we have to send the cops after you and have you dragged back here. Because
and they don't understand that. You want to know what? I mean, I don't want to dox myself. The hospital that we had sent him that morning to the hospital, it was the day of his discharge anyway. He had to go to the hospital. He ran away from the hospital without telling anybody, without signing any forms, to get to our facility to get his stuff to discharge. But he never told the hospital. He never signed any paperwork with the hospital. I got a call from the hospital warning us that he had fled. Like, I forget the term they used. He was like he eloped. That's what they said. He eloped from the hospital, and they warned us. They're like, we don't even know where he is. They're like, our cameras saw him getting into a lift, and we don't know where he is or where he's going. And I was like, well, hopefully he's coming back here. I got all his stuff, put it in the lobby, because I was like, you're getting discharged whether you went to the hospital or not. So your discharge time is here. And then, but he thought he was supposed to stay more, because I guess he thought that going to the hospital reset his clock on his insurance or whatever. It didn't. That's where the fight started. But I was like, listen, buddy, that hospital might be willing to put up with it. I'm not going to put up with it. Sign this paper, get out of my parking lot. Like, I got 189 other people in this facility I have to deal with, and they're all nicer than you. I don't want you here. Like, consider yourself blacklisted.
Yeah.
Yeah. But, like, in the field like this, I'm sure it's very touchy, because you don't know, like, the people or the background. But he's got like a little syringette. He's probably got like, what do you think? He's got like 2 milligrams of morphine or something. He's going to hit him in the arm when he's not looking.
Probably.
Calm down. You know what? Why don't you come over here and I'll show you how calm I can be.
But then the question is if he actually makes contact or if it gets turned on him.
Ooh.
Oh, he got him.
What was that?
Ketamine.
Ooh.
Really?
Yep.
Ketamine.
So what happens now? You're going on a happy adventure.
Dude, ketamine's powerful. Fucking,
All
that's
right,
horse
sir,
tranquilizer.
there's some orange juice. This should bring your sugar up. Thanks. But you know what, man? I actually don't think I need it. I'm feeling a lot better. You sure? Yeah.
Dude, blood sugar's so
I
weird.
think he might need it a lot more than I did.
That's a lot of sweating.
Yeah, I think my sugar might be a little bit low. You mind?
I probably wouldn't take the orange juice from the patient. I'd probably get more. Yeah.
He's on a new diet.
Yeah, he should stop being on that
Yeah,
diet.
he might not want to be on that anymore.
Dude, if you're sweating that
Probably
much,
not.
you're that dizzy.
Do you have any more orange juice?
That's not good.
Fire rescue, somebody called because they were feeling.
And I'll
No.
tell you something else. Sometimes people in the medical are the most unhealthy people you meet. Like, I got people at my place that smoke like chimneys, despite being like nurses. And it's like, I get it, I don't judge, but you can't do something that you know is going to affect you at the job. And if you're getting
The amount.
yeah, if you're dealing with a dude with low blood sugar and just dealing with him, like, low blood sugar typically comes with lethargy and like erratic movement, but never like almost never violence. If you can't handle a guy with low blood sugar and you're getting that sweaty and that out of breath, you got it. Whatever you're doing, you got to stop. Like, that's more than diet. Like, that's bad habits. That dude's diet is a cigarette and a white Monster. Like, that's not good.
Yeah.
Week.
Yeah, it was me.
Oh, hey. So what happened before you started feeling this way?
I was trying to help my friend put a bandage on his finger, but
Okay.
I don't
You
do
at least
well
put the
with
bandage on.
Oh, okay. Well, maybe let's not look at his finger then. Okay.
Uh-oh.
You need to
Hemophil-
say
what is
the
it?
word.
Yeah.
I don't do well with blood either.
Oh, they're looking at it.
Sir.
They're
I need
both
you to
gonna
take a
pass
deep
out.
breath, okay. Whoa. Hey, you too. Guys, come on. Both of you
You're
can't
gonna need 2
pass out at the
ambulances in a
same
second.
time.
Yep, there it is.
Yeah, I'm just gonna see if the floor is calm.
Dude, I can't remember. What is it called?
Pet dismount.
Yeah. What is it? Not hemophilic response. Hemophobic response? What's the term called when you pass out when you see blood? I can't remember the official term.
I
It has a
actually
real
don't know
name.
the official
I just know I don't have it. I'm fine with blood. I mean, I'm not.
Obviously,
I
am too.
I'm not. Don't get me wrong. If I was like shot in the chest, I'd probably be scared, but not because I'm bleeding. Probably because I'm shot. Like, I can typically deal with it. I just can't do like I can't do like waste. I skeeve too hard with like poop or pee. I just can't do it. I'm like, can someone else please? Like, I'll do anything else, please.
Anything
I just can't
else.
do it. I just can't do it. I can't. That's why I can't have a kid. I'd be like, can someone raise it for the first 10 years? I can't. I can't change diapers.
Yes, you were right. It's hemophobia.
Hemophobia, yeah. I was like, you get so scared that it like your brain shrinks, or the vessel in your brain shrinks, and it makes you pass out, so you don't have to see it anymore.
Yeah.
And you know what it is? What's even worse? I mean, they were already sitting, but I'm sure in real life they stood up. Both of those people have to go in ambulances now because they could have sustained head injuries from passing out. So now they both have to get
Fantastic.
CT scans.
911. Somebody called
I actually
for a
just
call.
recently
Yeah.
had somebody. We were drawing blood. I wasn't in the room when they passed out, but I ran to like the code that they called when they passed out.
Yeah.
But just recently, one of my coworkers was drawing blood, and the guy just knocked.
Yeah, dude, it's crazy. Some people just cannot do. Like, when I get my blood drawn, I can't stop laughing. Like, they think I'm crazy. I laugh like the Joker, because I don't do pain well. So it diverts to comedy. So like when someone's drawing my blood, like I have good veins, so you can draw my blood pretty easy. But when they're like, oh, it's just gonna be a prick, it's like I start giggling when they put the needle in, and then as you could feel the blood leaving your arm, I just start chuckling, like, and I can't complete sentences, and they always stare at me, and I'm like, listen, it's this or you're gonna get me like all nervous and like shaky. It's just like I'm a normal person doesn't like watching a pint of blood leave their body. Like, that's not normal. The blood is supposed to stay in the body. But I just laugh so loud about it. Every nurse who's ever drawn my blood has like given me a cocked eyebrow, and I'm like, I swear to God, I'm normal. I swear.
This isn't a psychotic break.
Yeah,
I promise.
swear. And they always put up with it too because I'm O positive. So they're like, you know what? You're in demand enough. I'll put up with it.
I called for him. Hi. Why are you leaning that way?
One of these hooks are in my shoulder.
And why is there a hook in your shoulder? Oh, he was finishing the last rep of an AMRAP WAD, butterflying into a bar muscle up when his grip broke, catapulting him off of the bar into a reverse V up right onto that
Oh,
hook.
so he does
I
gymnastics.
can't see it. Hold on, I can't
I have
see it.
absolutely zero clue what you just said.
I fell off the bar and onto the hook.
My thing just
Yeah,
glitched
it was
out and I
this
can't
close
see
to
anything.
finishing.
We're good.
So what happens now? Now we try to figure out how to get him and the meat hook of death down to the hospital together.
But yeah, I mean that was hilarious. I love how
Welcome back to numero.
that was hilarious. I love how relatable that is. I mean it's just so like my favorite by far. My favorite by far is the fucking dude with the soap bottle. The dude with the soap
my
bottle,
God.
man.
The amount of
It's just the
people-
amount of people who end up in the fucking ER with something up their ass that's not supposed to be up there is
Ridiculous.
It's ridiculous in the sense of like it's amazing, in the sense of like wow, I can't believe there's this many creative people who can think of so many different things to shove up their ass. And also you also got to think about just the motivation, right? To get it up there. Some of these things.
My thing is like, it's not even just as medical professionals that's a well-known thing. Like, I feel like anybody that is at least like an adult age knows that a lot of people end up in the ER from putting things in their butt. And yet people continue, it's still a thing that happens all the time.
Yeah. I think it's one of those things. It's one of those things that I think people are, they're like, "Oh, it couldn't possibly be me. Like I know better. Like I'm better at it. I can do it better. It's got to be something along those lines." And it's just it's just hubris. It's like, "Oh, they were being dumb. They used this. This is obviously way better." And it isn't. It's just the same thing in a different shape, and they just don't understand that there's no, that's not a normal thing. You're not supposed to be doing that. So when you do it, like there's procedures. Like there's a reason why suppositories are like shaped a certain way. They're usually a certain size. You only use them in certain situations. Like you're not just supposed to be shoving stuff up your ear. That's not advisable medically.
Nope.
Even when you have to take like temperature, it's like there's a reason we have thermometers that go in the mouth and also core temp thermometers that go in the rear. It's not like, oh, everything goes in the rear all the time. That's the best way to do it. Like no, it's circumstantial.
Yeah, we only ever do that if we have to do it.
Yeah,
Because it's
if you
just
have to
not,
do it, or,
like...
yeah, if you need like a reliable core temperature, right, or if there's like some sort of obstruction in the mouth or something. But it's like there's certain standards that are set in place to not have to worry about certain things, and you put yourself at so much risk by doing that. Like even just like medically speaking, right? You tear your large intestine like that, and you get fecal matter in the body cavity, sepsis. That you're talking extreme infection. You need broad spectrum antibiotics for a long ass time, not to mention surgery to fix the bowel, and then they got to run the bowel.
Yeah, and that's assuming that they that's assuming that they can fix the bowel.
Yeah,
and not
you better
just
hope
give
they can fix it, and then they got to
a-
run the whole thing to make sure there isn't any other tears, and then it's like they got to wash everything out, and now you're talking tens of thousands to hundreds of thousands of dollars on surgery because you wanted to cram a statue of Jesus Christ up your butt on a Friday night.
Oh my God.
Like just do anything else. Just go to a bar, pick somebody up. Do anything else. That's my I'm not a doctor. I
or
will
at
not
the
give,
very
yeah.
least, if you really need to do something, use a toy. Use something that is made specifically for
Yeah.
doing that.
Yeah,
like
please. Like I will not stand.
at least your odds are more likely to go your way.
Yeah, I will not stand on the high horse and tell people what they should and shouldn't do. I'm not a doctor. I do not have a doctorate. But you don't need a doctorate to know that there's no good outcome to getting something shoved and stuck up your butt at all.
No.
Like I've seen enough, you've seen enough. Trust us. If you take one thing from this, don't shove
put things
things
up
up your ass, please. And as far as like the most like realistic, like that is definitely one of the most realistic things of those skits. And I say probably one of the other realistic things is almost certainly the standard accident, right? It's like, oh, the car slipped off the jack and it crushed the guy. Like accidents during automotive are almost always really bad because of just the nature of the accident. You know, it's like you're working on your car, you get zapped by the battery, you get crushed by something, you get your hand crushed by something, and then it's like your fingers. I've seen fingers. I mean, I haven't seen it in person, but I know people who are missing fingers because they got their hand in the pulley, and it's just like, oh, there you go, you just lose 2 fingers like that because it was running because you wanted to test it because you thought you could be faster than the fucking engine, and then, or God forbid, the flames, fire, chemical burns. There's just so much stuff that happens.
always an advocate for, no matter how like unserious you think it is, like make sure professionally that it's not before you just go about your days.
All you need is to get unlucky enough to hit your head. Now you got well, I know brain bleed, but I forget the official term, like subcranial hematoma or whatever it's called. But you get one of those, it's a slow bleeder. You go to bed for 8 hours, you just don't wake up. And it's just like, well, because I hit my head, and it's like, well,
That's terrifying.
shit, dude. It's like that's one of the worst things about learning medical stuff. Is like all of a sudden,
Is knowing all the ways that
sickness-
people can
yeah.
die without realizing that they're going to
every
die.
every flu feels like a 1 in a million sickness because the symptoms match. Every time your head hurts, you think it's brain cancer. Like it's the classic when you hear hoofbeats, think horses, not zebras. It's like all you're thinking of is zebras because you just spent all this time learning about zebras. Like I've seen so many diagnoses in the nursing home for things that you'll only ever develop when you're like over 60. And in my head,
There was one day I thought I was genuinely concerned. Like, I had the worst migraine ever that I've ever had before, and I was like, this is not great. If this doesn't go away within the next like hour, I'm going to the hospital because this might be a stroke. Like,
well, yeah, because that's what the first thing you're thinking, right? You're thinking stroke, you're thinking thunderclap headache, right? And so it could be like a precursor to like a grand mal seizure. So you're like freaking out. You're thinking of all these things. Sometimes it's just a headache, and it's like, oh
sometimes
god.
it is just a headache, but it's really hard to know.
Yeah. But that being said, if you take one thing from this, don't ignore medical shit because you think you're tough. Like if you hit your head, get checked out. If a car drops on your chest, go get checked out.
Call 911.
Call
Like,
911. And the most important thing before we leave you here today, please don't shove anything up your butt.
Yes,
Everyone
please.
will be embarrassed in that situation. No paramedic will ever get upset that they didn't have to remove something from your rectum. They will thank you, in fact, for having not to do that. So if you take one thing, and until next time, those are our parting words.